First thing I'm going to do is wash my hands. And then I'm going to sign into the MAR. And I'm going to scan the patient ID band. Alright. And I see we have scheduled gentamicin, piggyback, 80 milligrams IV daily. Just going through the 5 rights, I see that we have the right patient, Marty. The right time is 1400. The right route is IV, piggyback. The right dose is 80 milligrams. And like I said, the right med, we have gentamicin. So now I'm just going to inspect the package and just make sure there's no contaminants in it. I see the expiration date hasn't passed. So now I'm going to look at the rate of infusion that we've done. And now I'm going to label my tubing, just with his name and the medication, dose, and my initials. Now I'm going to do my second check. And then again, I see that I have gentamicin, 80 milligrams, IV piggyback. Alright, and now I'm just going to inform the patient that we're giving him gentamicin through the piggyback. Gentamicin is an anti-infective, therefore it prevents bacterial infections and treats them. The common side effects can be ataxia, which is a loss of balance, or vertigo is a sense of dizziness, and those are the most common side effects. And after we do give you the gentamicin, we'll just monitor for infection by doing things like vital signs and just assessing the IV insertion site, things like that. So now I'm going to do my third check. Okay, before I do my third check, I'm going to ask you if you can state your name and date of birth for me.
Marty Rabbit-Tail, March 15th, 1978.
Thank you very much. Now I'm going to do my third check. And I'm going to scan the gentamicin. And once again, I see we have gentamicin, 80 milligrams IV daily. And I also see that the patient's BUN and creatinine levels are within normal limits. And now I'm going to inspect the IV site for any infiltration or phlebitis, any irritation. Now I'm going to put on clean gloves. And the first thing I'm going to do before we flush with normal saline is clean the IV port. And we're going to flush with normal saline, 2 milliliters. I'll let that dry a little bit to get rid of my bubble. Okay. And after we're done flushing, we'll prime the tubing. Alright. So now I'm going to take the cap off the gentamicin. And we're going to give this a quick scrub with the alcohol wipe. Now I'm going to begin to prime the tubing. And then since it is an IV piggyback, we're going to be hanging it higher than the primary IV that's infusing. And first I'm going to have the roller clamp closed, and then I'm going to open it to correctly prime the tubing. And then once I see that the liquid hits the bottom, I'm going to close the roller clamp. And now I'm going to lock it in. And now I'm going to unclamp. And then I will assess you right now and see how well you're tolerating the piggy bag, and it seems like you're doing okay. And then I will also come back and assess how you're doing after the infusion is complete. So now I'm going to document my procedure in the EMAR.